Gabe, how's it going?
Good, Michael. How are you doing?
I'm doing pretty good, man. Guys, just for anybody wondering, right now before we started recording, Gabe, you told me that you were like, when I first reached out to you, because I reached out to you to interview you, right?
Yeah.
You replied back, sure. And I was like, this guy, does he want to be interviewed? Does he not? Because I felt like you were like, all right, I guess I got to do
Uh,
another.
well, let me check the exact time because based on the time of when you asked me, it could be a sure or it could be like a detail. We'll see. Oh, no, let's see. Hold on. Time was, yeah, it was 1:30. So, yeah, I probably was in the process of coming back from lunch. So, you probably definitely got a sure.
Yeah. No, but man,
Okay.
I truly appreciate it, man. Thank you for letting me interview you and letting me be nosy in your life and stuff like that. So
Well,
we're
hey,
gonna get
thank you. I'm
into it.
honored to be on the show.
No, thank you. So, Gabe, if you can rewind back a little bit, tell us a little bit about your past, your present. How did you get to where you are today?
Wow. So we'll try and make it in a nutshell as quick as we can. So I grew up in a small town outside of Columbia, South Carolina. I grew up in Irmo initially, which is a small town, then Chapin. Um, and part of my interest in dentistry came from a very young age where I experienced some dental trauma that had me to go get dental work done extensively at a dental office. And it wasn't a very great experience. It was a really poor experience, actually, looking back, and it kind of caused me to have some fears, some apprehension. And as we moved, my family changed dentists, and one dentist who literally took me from a dental phobic, someone who was scared to go to the dentist, to someone who wanted to become a dentist. And Michelle Mistally is her name, and she has been a mentor of mine for years, and she really helped me kind of solidify my career path. But it wasn't until dental school that I decided, I was like, hey, you know what? I like kids. I've always been around kids growing up my whole life. I've taught Sunday school, been part of after school programs, things like that, that pediatrics seems like a really good fit for me. And particularly working with patients with special needs. And so decided to pursue a specialty in pediatrics and didn't get into residency my first time I applied. So I did a GPR for a year at the Ohio State, as they like to call themselves. Okay.
Yeah.
And was one of the greatest years of my life. Absolutely loved it. I got to learn so much. Um, the attendings that were there, the dentists that have been practicing for years, uh, Brian Turbo and Dan Reed, both awesome, phenomenal clinicians, and just really knew a lot about practicing and how to go ahead and how to treat patients, not just
Mm-hmm.
fix teeth, how to treat patients as a whole. So I learned a lot from them. Then coming back to Charleston to do my residency here in pediatrics, I had a very firm foundation on dentistry, but learning here at the Medical University of South Carolina really helped me to understand how to treat pediatric populations and also patients with special healthcare needs in the community and around. So that's kind of where I'm at. When I graduated, I went and joined a large group practice in the area and worked for them for several years, knowing eventually that I'd always want to open my own practice.
Mm-hmm.
And it kind of came to a point in my life where my wife came to me one day and she said, I know you're not really happy with the situation that you're in working for a large group. I think they had at that time seven, maybe five or seven offices and like over 30 dentists. So I really didn't feel as though it was a place where I felt really comfortable with because I'm kind of more of the small town kind of feel. So
Mm-hmm.
my wife said, hey, I think you need to find some place you can be happy. She's like, you always wanted to start your own practice. Why don't you do it now? And, there's all those reasons why you can't do something. I don't have the money. I'm in debt. I don't want to, take the risk and everything else. And my wife just constantly encouraged me, was like, hey, if you want this, let's do it. Let's go in
Yeah.
it full force. Let's jump into it. She'll support you. I'll do whatever we have to do to help out. And we'll make this dream a reality. And so we started on that process, and it took probably about a year and a half until I was opened in my own office and seeing patients to get there. And the entire time, she encouraged me and helped me, and as long as other friends along the way, kind of opened my own practice. And now I'm working for myself, and I'm also doing something that I've always loved to do is that I get to teach part time at the university. I teach pediatric dental residents,
Oh
which
wow,
is
cool,
something
man.
that just, I mean, I've always loved teaching. It's always been a part of who I am, including before going to dental school, teaching for a while at the college level. And so I tell everybody, hey man, I'm living my best life right now, living the dream, having fun, getting to go to work every single day and be super happy with what I do and who I am and where I am in life. So that's kind of my past, my present, my future. Uh, there's been a lot of detours and roundabouts and turn around and go backs in the process, but
Yeah.
for the most part, that's how everything's gone down in a nutshell.
Yeah. And you know what, man, Gabe, like I could really tell. Like, so for anybody, for the listeners right now, we're recording. It's 2:30 my time, 5 your time, right?
Yeah,
And
5:30 in the East Coast.
this is about I think this is my sixth or seventh interview right now. And Gabe was
Ooh.
like, "Hey man, how's it going?" And I'm like, "This guy has energy for 5 p.m. Like, you're doing amazing, man. Yeah, I could tell. I could tell you like your energy. Like, I feel like you really do love what you're doing, man. That's awesome. So, how long have you been owning your own practice right now?
So coming up December 1st this year will be 1 year of being in a private practice by myself. And then I finished dental school in 2014, and finished my general practice residency 2015, and my pediatric specialty in 2017. So I've been practicing dentistry in residency in the community since about 2014, and been working in private practice since 2017.
And then you started teaching when?
So I started teaching, believe it or not, the same month, the same week I opened my practice. It was wild how it worked out. I got a call from my old program director, and she was like, hey, I know you're opening a practice, but we really would like to know if you're available to teach because you've always had a passion for teaching. And of course, I was like, well, I got to talk to my wife and, think about it. And in my mind, I already knew, oh, absolutely, I'm going to do this 100%. And so we went ahead and we, went through everything. And there's a process getting hired on in an academic setting. And it's kind of a different process, but there's a lot of, filling out paperwork and doing background checks and interviews and, onboarding is a term that academic institutions like to use. And basically that means you're going to sit down, you're going to go through a lot of forms and what you can and can't do. So
Yeah.
through all that process, we finally got started with seeing the residents and the students, teaching them in the clinics at MUSC, which is actually based in Charleston, downtown Charleston, South Carolina, about 20 minutes from my house and about 45 minutes from my practice.
Wow.
I started teaching them, and then this big guy came in March named COVID, and kind of made things really crazy for a while for everybody. But I got to help with doing webinars with the residents, doing live kind of discussions with them while we were all in quarantine and kind of, not leaving our homes. I got to still work on teaching and, sharing my experiences with them through a online forum, which was interesting. I don't know if I'll want to do that ever again in my life, but it
Yeah.
definitely is, the world's been changed forever. And I don't think, I think we've done a lot of learning. There's been a lot of personal growth during that time. And, part of learning is sometimes we have to be stretched to places that we may not be 100% comfortable with. And we have to
Yeah.
learn how to thrive and abound in those areas we're not comfortable. So, did that. And then when we started seeing patients back, with all the new guidelines, of course, the residents were trying to make their requirements for graduation and finish their programs so they could finish off and be accredited as finishing an accredited program, and trying to get all those patients in and stuff. And so it's a fun time. And actually tomorrow from 8 to about 5, I'll be at the medical university again. And I go about a day and a half a week. I'm working down there, helping residents, being attending, doing whatever needs to be done,
Mhm.
including, helping to fill out forms or type in for a resident as they're going ahead and doing an exam, or write things down, or, share experiences with them, or have them shadow me at my office. So a
Wow. Yeah,
lot
man.
of fun times with that. But that's kind of what we've done. As my practice has grown, I've also grown in my teaching at the medical university nearby. So
Wow. So you kind of like started your own business and took on a job at the same time, basically. And
yes, yeah.
and do you feel okay? So then I know you said how you have a kid, right?
Yeah, so I have a son who is 2.5 years old. And then we also have a dog that we got before we had a child because we thought if we can handle a dog or animal, we can definitely handle a human. And that was a gross misunderstanding. Like, I mean, being a parent is fantastic and I love my son, but I thought my dog will go and sleep by himself, right? He'll just walk off and get bored and stuff. My son doesn't. He's like, I've got to be like doing stuff. And he's kind of a little bit like his dad in the fact that he always has to be doing stuff unless he's like completely passed out of sleep. And so it definitely makes for interesting times because when he gets bored, he gets, cranky and fussy as opposed to a dog who just, I'm going to go lay down and just. A dog and a son. And that's it for right now. We don't know what the future holds, but we'll see.
Man, so you're like nonstop busy. Okay, so then we'll get back to that right now. We'll get back to like how you're managing with everything. But right now, let's dive a little bit into your practice, your business.
Sure.
Okay. First and foremost, who did you go with the bank to get a loan to make the startup, or how did that work out?
So yes, that's kind of how it started. So initially, I was very interested in starting a pediatric practice. And there's a couple of pediatric consultants that are out there. And one that I found that I used through the whole process, and he kind of was my guru, my Yoda, my mentor, was Bobby Elliott out of Pediatric Dental Solutions. I can't remember the name, but he's very well known in pediatric dentistry and has helped a lot of dentists start their practice. And so I sat down when I wanted to start a practice and called Bobby and said, hey, I want to start a practice. What do I need to do? And Bobby's been literally doing this for forever. And so he kind of said, look, Gabe, this is what you have to do. You gotta go find a banker. You got to find an accountant. You got to, talk to some reps. You got to get a real estate agent to look for some property or look for a space. And so started with that. I had some friends who started a practice about 2 years before me, and they used a banker in town locally. And I met with this banker, and it was with, can I say the name of the bank that I met with?
Yeah, of course. Uh-huh.
Okay, well, not to like promote them, but I had a really great experience with them. So
yeah.
So I use PNC Bank, and they actually have a very robust dental loan and dental, startup practice loan process. And so I worked with a guy who literally lives 3 miles down the road from my house. And when I was starting my practice, I was very, I would say close-handed. I didn't want to show my hand to a lot of people and stuff because, with the community within dentistry, it can be very easy to go ahead and share things. So I kept it very confidential and quiet. And Andre met with me several times, at my house. He met with me at a coffee shop. And his theory the whole time was, hey, look, you're busy. You have a life. I'm a banker, but I don't have to meet you in the bank. He said, the initial process is determining what you're looking for and see if I'm a good fit for you. He said, because I may not be. And only you can determine that. So I sat down with him and we went through the whole entire process. He gave me kind of some projections from previous clients that they kind of used to show, not de-identified, but he kind of showed me, this is kind of what we're looking for from you to get your loan. So he gave me all the information that I needed to modify for myself, including a business plan, and said, here, modify this and then give it back to me. And that will be the information we need for the loan.
So then when you presented him the business plan and the loan, it was not the first time. It wasn't like, I guess if let's just say Andre wasn't the way he was, he would have been like, no, I don't like this, reject, right? Or would he have been like, so then the question is more like, what did you have to modify?
So I worked with Bobby because he had part of the consultant package that he had is that he included things like projections for your business to start up. He included anticipated costs, a business plan, a proposal to ask for money and how it's broken down. So I used some of that from Bobby to go ahead and use to approach the bank and show them my values. And the accountant that I chose to go with actually had worked very closely with the banker that I decided to go with. They knew each other and they both recommended each other independently without knowing I was talking to either one of them, which was kind of a nice thing. And so the banker, Andre, called me back and said, hey, look, your projections need to be massaged a little bit here to make the bank happier. So what I'm going to do is I'm going to talk to your accountant, and we're going to make them so that we can have them to be accurate and within what we anticipate. But also, he goes, I don't want you having to waste a bunch of time on this. So my accountant and him spoke a lot. They finally came to an agreement on what a realistic projection would be for my production, what they could anticipate me making in the months to come, what my anticipated cost would be based on the area that I'm in, and then also what I would expect per patient coming in. And so by the time I submitted it to him, we had already gone back and forth about several questions, via text, via email, like, hey, what do you think about this? What do you think about this? So if I had not known Andre and not had a relationship with him or gotten to know him before the process started, I probably would have gotten a lot of rejects back and forth. But having somebody like him at a bank who knew what the final goal was, what I wanted to get to, helped me to go ahead and to achieve my goal so much easier with a lot less stress on my part.
Gotcha. Okay, I like that. So then, if you don't mind me asking, how much, or if you can give me a range, how much was the loan for?
So I learned this when I was doing some, projections and things like that. So on average, most loans from a bank, if you're doing a startup for a dental, are going to cap out for a single provider at about $600,000. And that's from my region. Now, I know that can vary base to base when I see, but my total loan was $550,000 that I was awarded by the bank as saying, look, this is our lump sum we're going to give you to go ahead and do your construction, to do your dental equipment purchasing, your supplies, and also to do your startup capital. Okay. And the nice thing I liked about PNC is that they make it as a draw for you the entire time. So when I first started drawing on my loan was when the interest starts accruing, but not until I started drawing. So to step back for a second, when it came time to negotiate my lease, I negotiated specifically in my lease that my tenant upfit or my tenant improvement allowance would be paid first. So that a lot of my fees, my design fees, my initial, demolition and plumbing, a lot of the initial costs for construction were paid from my tenant improvement versus having to take a loan and then get a check at the very end to catch up on that. Does that kind of make sense a little bit?
Yeah. How'd you do that? How'd you get into, did you negotiated the lease on your own or did you get somebody?
I had a real estate agent that I got connected with by the real estate agent who sold me my house. He moved to Alaska with his wife. And he put me in contact with a commercial real estate agent who was about my age and had some experience in the area and went ahead and helped me to negotiate a lease and kind of looked over it and said, hey, look, these are things that I think we should ask for because these are things I've seen in other leases from not just dental, but other specialties, in the area, medical, business, things like that. He said, these are areas of negotiation you can have. And he said, no, obviously, we're going to ask for the sky. And they're going to come back a little lower. And then we're going to ask again. And then we're going to kind of reach a happy medium somewhere. He said, there's going to be parts you're going to give on. There's going to be parts you're going to take. And no lease is going to be 100% perfect, right? He said, it's not going to be 100% perfect. You're not going to get every single thing you want. He said, but you can reach a reasonable compromise where both parties have a mutually understanding and mutual agree upon lease. And that makes things easy. I did have an attorney read over the verbiage just to make sure everything was okay and that everything was, kind of where it needed to be legally. So I didn't have any loopholes where if I were to have some issues, such as I need to walk away from the project due to finances of my own or due to acts of God or things like that would occur that would be out of my control. I wouldn't have to go ahead and be stuck with this massive bill personally to take care of that. So I did negotiate a lease with a real estate agent as well as with a lawyer at the end, kind of reviewing the contract, which was not cheap. It's
I was gonna say that would time consuming might take more than what you want, but price wise, you're on a budget.
If you're gonna get into a lease for 5, 7, or 10 years. Which, my lease is a 10-year lease with 2 5-year options added on. So if I wanted to renew my lease, I could for 5 more years and then 5 years after that. Which, is kind of, it can be standard, but so there's lots of ways your lease can be modified, right? Like if you were to have a shorter lease, you might get less tenant improvement allowance given to you, or you might have less free months of rent. So there's that give and take within the lease. And there were certain clauses that I wanted specifically in my lease, such as I'm the first dental provider in my medical complex that I'm a part of. And so I have certain exclusions in there saying that, hey, if you're going to bring in other dental providers in the area, I don't want them to be in competition with me. Mm-hmm. And by being the first guy in the area, specifically in my area, I'm allowed to do that. But then they also had other requirements of me, being the fact of, hey, you're a dentist, you cannot provide medical procedures in your office. Because, we're different type of medical providers around you. We're not going to allow you to do that. And, they're protecting their interests. I'm protecting my interests. That had to be read over by an attorney, which you're right. It's time consuming. It takes time and it takes back and forth and lots of emails. And I learned the definition of a lot of words that I do not know what they meant, but apparently when you're attorneys,
yeah,
word can be interpreted in different ways. Okay. So we'll leave it there for that.
Yeah.
Attorney, but it's
you.
Very interesting. As I read a contract, it means a lot differently to me than it does to an attorney.
Definitely. I get you. So then how'd you find your location right now, the one that you're in?
So, funny story on that one. Kind of by accident. So I looked in the area. I did a demographic study of the area that I was in, working for a large group practice in the area. I had a non-compete for the area. And so I knew areas I didn't want to go. I knew areas I wanted to go. And I knew areas of growth that were happening in my area. So I looked at a place a few miles down the road and had a spot. It was a builder contractor who was going to build me a building from the ground up and was going to let me buy the land and the building after so many years. And I went back and forth on that spot for about 8 months with negotiating. And in the end, it ended up falling through because of some just personal things that came up that didn't feel me like 100% confident about the deal. And just some things that were not able to be put on paper to let me know what I was getting. And so I had to walk away from that deal after 8 months of negotiating and paying for lawyers and attorneys. And I was really upset and was kind of like, man, I'm not going to build a practice. Like, I don't know what's going to happen. And, my real estate agent called me the next morning. He's like, hey, Gabe, look, I know you're upset, man, this happened, but look, it's probably for the best in life. He's like, this spot we looked at previously, he's like, landlord just came back and said he'd be willing to negotiate with you on the TI. Like, do you want to possibly sit down and have a discussion with him? And I was like, man, I don't know, man. Like, maybe, I don't know, we'll sit down. And so we sat down and he kind of, painted a picture for me and I got to meet the landlord and I was like, you know what? This guy sounds really genuine. He seems like a really good guy. And so I said, okay, we'll talk. We'll have a negotiation. I'm trying to play hardball, obviously. I left from the dance floor. I'm not going to happen yet, right?
Yeah.
So I was like, okay, we'll see. I'm going to be hardball this time. And he just came forth and was really honest about everything and just straight up with everything. Like, hey, look, we'd love to have you, but if it's not a good deal for you, then hey, man, I understand, but it's not exactly what you wanted, but can we make this work? And so after about a month of negotiating that one, we kind of decided, I was like, hey, you know what? This is it. This is going to be it. And this is going to work. And we're going to go for it. Let's do it. So we jumped on it. We pulled the trigger and we signed on the lease and we got started. And this was, I would say, May 2019. And I went ahead and picked a general contractor and signed with him in July, and they started working and ran into all the fun stuff that happens, like you're working in an office building and they're like, we don't want you making noise. I'm trying to cut concrete here. There's no volume on that. I can't lower the concrete saw. I don't know what you want me to do. And then some issues with, plumbing, like the plumbing on the plans that we were given to design weren't exactly where the plumbing was. It was a little different. And so having to spend a weekend coring through a concrete footing for the entire building kind of like, Mission Impossible style with the big hole saw that goes through. And I got to just watch it and literally sit there and realize and calculate in my head, per minute, this is costing me an insane amount. But I'm just going to watch this because it's fun.
I'm just gonna watch
But,
this.
all those kind of things, and just kind of rolling with the punches. And at that time, I was actually working out of the city. I was working 3 hours away. So I would,
Wow.
on Sunday, I would get my car, I would drive 3 hours away. I would go work in a different practice, and I would come back late Thursday or Wednesday night, do stuff for the business on Thursday and Friday, check on the construction site, and hope it made progress through the week, because I was like back and forth and here and there, and then trying to set up credentialing with insurance this whole time, and had to find time to hire and interview people. And so it was an adventure. And we finally had patients scheduled December 9th, and then had our walkthrough from the city December 2nd. I literally walked around with the contractor and the building inspector, and it's very stressful. He kind of just sat there, and I was looking, and all of a sudden he went, okay, and just signed off. And I was like,
Okay.
That's it? Oh my gosh, I thought this would be I have to change everything. And he was like, no, that's okay. He just signed off. And I was like, well, that was a very anticlimactic moment. But I had occupancy. We are rolling, baby. Let's do it.
I know. That's so good, man.
It was good. It was a lot of fun. It was a stressful time, but that's kind of the process that I had for getting started with that.
Gotcha. Okay, so then what did you do in order to start seeing new patients before you opened? What kind of marketing and advertising were you doing?
So I kind of was a little behind the 8 ball on that one, in the fact that, with having my name established with another practice in the city, I had to be very careful with how I marketed myself, as to not intentionally, solicit patients from that practice to come see me. And I had to be very cautious with how I was going ahead and, doing that. So one of the things I started doing, and I did from the very early on, was I made a Facebook page, which literally takes 5 minutes to do for your business. And I created an Instagram account, and I just started posting. And I started posting things like, coming to the area, can't wait to see you, posted pictures of construction, anticipated opening dates. And then I started people calling me. I had a few people call me, and they were like, hey, we saw your Facebook ad. And when I started a Google number account, Google Voice. And then I switched that Google Voice to Mango, and used Mango while I was getting my practice built at the very end, and have those phone calls come to my phone from Mango. And then was using that to help schedule patients and things like that. And they were like, hey, we're friends of yours. We'd love to come be your first patients and get to know you. Or, our dentist said we need to go see a pediatric dentist, so we can get in to see you. And their opening date kept moving based on construction. So they were very patient with me, and we were to do that. But for marketing, I kind of was doing marketing on my own. I probably would say all of December and then most of January. And I have a friend of mine whose background is in entrepreneurship and marketing. And he was graduating from College of Charleston at that time. And he said, we were having dinner, I think, one night. He was like, hey, Gabe, who's doing your marketing for you? Who's doing your advertising? Who's going ahead and putting ads out? And I'm like, man, I opened a Google Ads account, but I don't know how to do it. I'm kind of just floundering. He's like, well, this is my background. I don't have a business. I work for another company per se. He's like, but I mean, man, you're my friend. Can I help you with it? Can I help get this off the ground for you so you can start getting some traffic coming in? And I was like, I mean, yeah, Asher, if you want to, yeah, that'd be great. And so we worked out a deal that would be mutually beneficial, where he would help me create ads with Google and with Facebook. And so really, I would say in February, when he took over, starting to go ahead and do planning, he really went ahead and started marketing super heavily with Google ads, and also on, paid advertising, as well as add search words. And then really got me interested in posting ads on Facebook kind of weekly to blast out in the community to get people interested. And most recently starting with, boosting posts and I don't know exactly the term for it, but recycling reviews. Does that make sense?
Getting the reviews and then posting Posting
Yes.
about it? Okay,
So,
gotcha,
yes,
gotcha.
so posting about our reviews and like patients who reviewed us were really happy with their experiences and using those reviews to market. And so Asher really helped with that. He helped with making sure that, making sure that when people went ahead and saw the ad on Facebook or on Google as they're searching for pediatric dentist, that they were able to say, okay, hey, there's a new pediatric dentist near me. Who is this guy? And like see the name. And then some people Googled it and were like, oh, I know that guy. I used to see him. I'm going to go look him up and go see him. And so looking at that and then, going out in the community and meeting my referring dentist, I spent probably the first 2 weeks of practice just going out every day during lunch between 12:30 and 2:30, and I would just go out to these dental offices and bring them movie tickets. So this was something that I learned from Bobby, and it was a really cool thing. And I don't know how people do it these days, but Redbox. You ever seen little red boxes in the grocery store?
Yeah. Huh?
So Redbox has the ability for you to buy gift card codes off their website. And Redbox, if you're hearing this, give me a discount, please. But you can go ahead and you can purchase these gift codes, and they're like $1.50 per code. It's a free movie. So we put together this little gift basket of a popcorn, individual popcorn you put in the microwave, a candy bar, a chocolate candy bar, not the bad stuff, the good stuff, full size, okay, and a business card, a pen, and a movie pass. And I would call these offices and I would go to them and I would have enough in there for every single person in the office to get a free movie. And I would give them out to the staff. I would give them out to the doctors. I would give them our referral pads, some promotional items like a cup with our name on it, and a koozie, and a few other promotional items, and gave them to them. And it was amazing because the staff were blown away the fact that they got a free movie. And they mentioned to me several offices I went to, they're like, hey, usually only the doctors get movies, or only the doctors get the stuff from referring doctors.
Mm-hmm.
And so it kind of opened my eyes. I was like, oh, you know what? This is something that no one in my area is doing. I've got to do this. And so we really started capitalizing on that. And from that, it got me some relationships with other referring doctors in the area where I would always tell them when I met them one-on-one, hey, look, here's my cell phone. And, even if you have a different pediatric dentist you refer to, if you have a question about pediatrics or you have a question about pediatric dentistry, here's my cell phone. Like, talk to me, send me a text, call me. If you need some help, I'm available. I can help you, just let me know how I can help you and your patients together. And kind of opening those doors and kind of, creating that avenue of open communication between referring doctors and myself, and getting them comfortable with the idea of, hey, when you're sending your patients to us, we're going to give you a letter as soon as we're done with our treatment. And we're going to say exactly what we did and how we did it, and that your patients have work been completed. And so some of the older doctors in the area especially are, really like the letters. We do letters that go in the mail, and I sign every one of them that goes out to them so they know, like, your doctor saw them. And then also, just showing them that, hey, look, we're a private pediatric dental offices that has all these options available for your patients we can talk about. And that, for me, really helped to solidify my presence in the area. And then as time went by, I noticed that there was another niche in my area, and that pediatrician offices. So I went to pediatrician offices in my area and other places that kids are seen by doctors. So ENTs and speech pathologists, and made a working relationship with a speech pathologist in my area who now exclusively refers to me for phonectomies and tongue tie procedures.
Wow.
And we got to work with him kind of by chance because I went to this course on phonectomies and tongue ties in children. And it's the TOTS course. And if anybody's listening and they want to learn more about tethered oral tissues in children or in adults, TOTS, TOTS, is a great resource you can learn about that. There's lots of courses you can learn about, but that is by far, I found, one of the most informational things because it's lactation consultants, speech pathologists, it's, sleep study doctors, it's, pediatricians, it's pediatric dentists, it's general dentists, it's myofunctional therapists, everybody coming together to say, hey, look, how can we create a community to help treat these patients who have tethered oral tissues? How can we take care of them? And so through that, I was able to make a connection with Guy is his name, actually. His name's Guy. And he's a speech pathologist in the area. And we're referring, not only he's referring to me, I'm referring to him for patients that I see that say, hey, look, this patient's 2.5, 3.5 years old. They're having issues with speech and they really need to see a speech pathologist. I'm going to send you to Guy. I'm going to show you. Guy's going to work with you guys on that. And he's going to help you with going ahead and working on the mechanisms to practice speech with your child. And then if you have a functional inhibition or a functional limitation for your phrenomes, I can help in relieving that functional by doing that functional release. So learning how to go just beyond the scope of dentistry, looking at other sources of referrals such as daycares, schools, even, other pediatric providers not within dentistry, speech pathologists, ENTs, pediatricians, all those kind of like opening up our horizons a little bit to let them know that we're a resource for them as well has really helped me with my marketing that I have.
Yeah, I never thought about that because in some of the courses or workshops that we teach, we talk about like, children's photographers, or we talk about lactation consultants and stuff, but speech pathologists, man, that little light bulb in my head, man, maybe we should start like, you're right. Like you have to kind of create a community that takes care of a problem. And I mean, you wouldn't have to worry about like new patients all the time. You just like, this is what they know me for. This is what we're going to cover.
And it's important to have that community because other medical providers knowing about you is going to help you immensely with having, I'm going to use the word street cred. Okay. Street cred in the community that you're in. You're not just some guy, some gal who's just flying by at night trying to make a quick buck. You're actually there and being a part of it, investing yourself in the community. So we also did some community events where we just went to community fairs and stuff, and we sit out there and we passed out promotional items and just talked to people when they came up. And as a doctor starting in practice, that was one thing that stood out to many of our patients. They're like, a lot of dental offices will go to these events, but the doctor's never there. And they said when those patients that we got from those fairs and stuff said, hey, the doctor was there and he took time to speak with me one-on-one, they were like, that kind of just solidified my choice to come to you. Mm-hmm. And so, yes, it takes time. Yes, it's usually on a Saturday or a Sunday or late at night or things like that. But all those things can definitely contribute to creating yourself as a established member of the medical and dental community in your area.
Gotcha. Awesome, man. That's really cool. So then talk to me about like how did you shut down, right, during COVID? And then how did everything kind of like recover from there? Did you see a significant drop in productions and collections and stuff like that? Or you didn't see anything?
So it was so terrible because I remember when March happened and, December was like rough, man. We just opened up and I was like, man, my numbers are terrible. My accountant was like, chill, bro, you're fine. Like, calm down. And then January, I was like, okay, all right, doing better. In February, I was like, all right, man, I'm gaining some momentum. Yeah, we got this. And then like March happened and I was like, oh man, this is great. I'm actually gonna do the best I've ever done this month. And then COVID hit in the middle and I was like, no, this is terrible. This sucks so bad. And I was like, it's terrible. So what we did is we shut down based on recommendations from our state. Dental board recommended that we close and only see urgent treatment. So I furloughed all my staff March 17th or something. I furloughed all of them. And so they could collect unemployment for themselves. And I went ahead and I took the phones home with me. With Mango, I got to do that. I took the phones home with me, and I would handle emergencies who would call in. And so parents would call around. It wasn't until like April that parents started really calling because they were supposed to have cleanings, they were supposed to have exams, and their kids are now in pain, And they would call, and so we would kind of, triage things over the phone for emergency patients and stuff. And if it was an emergency, an actual, absolute emergency, facial swelling, pain, waking up at night, things like that, I would meet patients and families at the office one at a time, and it kind of be just when I had availability to meet them. and I would meet them. We would take an x-ray. We would gown up in the full, do-wop ditties and the whole gowns and everything.
Yeah.
We would come in, we would do an extraction, or we'd come in, we would take a look at them. And I did a lot of pictures, I did a lot of FaceTiming and prescribing antibiotics and, kind of taking care of their urgent, emergent needs, taking care of trauma, things like that can't wait for those instances. And, all the dental providers in our area were doing that for the most part. A few of them were going ahead and seeing patients as normal. And that's, with every population, there's always some outliers, right? There's always some guys or gals who don't want to, follow the guidelines and recommendations. And that's fine. Everybody teach their own, and everybody has their own risk tolerance levels, and that's fine. But it wasn't until May 4th that we actually came back because, State Dental Board was like, hey, you can start seeing patients, as usual, but you should still social distance. And when we came back, I sat my staff down the night before we did a Zoom meeting, and I was like, hey, look, guys, if we're coming back, we're going to come back and we're going to come back strong. And I said, and when we come back, I said, it's voluntary for you to come back. Mm-hmm. Yes, there's risks, and yes, there's benefits. And we have patients to see who need our care. And part of being dental and health providers is that we're going to go ahead and we're going to take those precautions as we need to. We're going to certainly be very vigilant with everything we do in our office. But at the same time, we have children relying on us. We cannot put this off indefinitely for them because that puts them in a position that's not fair to them. And unanimously, my team voted to come back, and they were very excited about that. And so it was interesting is like we came back, and at that time I had a front desk and I had 2 part-time assistants. So they would kind of fill in as I needed them on certain days. I was doing just exams that day. I would sometimes fly solo by myself.
Wow.
And after 2 weeks of being back, one of my assistants gave notice, and I was like, oh, man,
yeah.
bites. And I was like, oh no, what am I going to do? And the day before she gave notice, I had my current assistant now, she emailed me out of the blue and said, hey, look, you're a pediatric office. I've always wanted to work with kids. I'm a dental assistant. I'm trained. And at that time, I was like, oh, I don't need an assistant, but thank you so much. And I called her like 48 hours later. And I'm like, hey, how did you come in for an interview? And she's like, oh my God, I'll be right there. And so we ended up hiring her, and she ended up working with us. And she's been fantastic. She's been wonderful. And, she's very young. She's very energetic. She's a lot different than my personality, which I've learned in hiring people. Sometimes it's not always wise to hire people just like you, okay? Because not everybody relates to people like you. And so, can I say her name? I can say her name, right?
Yeah, of course, yeah.
So first name, not their left, but Sierra, her personality, she's lively and bubbly, but she can also be very quiet sometimes. And I found for some of my patients who are more reserved and more shy and quiet, like they click with her like that, and they love her, and they feel very comfortable with her and happy. And parents comment like, oh my goodness, my child they're so shy, they don't talk to anyone, but Sierra, and they'll talk to her. And so I'm like, okay, wow, well, this is great. This is awesome. And then, we were working there for a while. We kind of got to the point where we hit that plateau where I'm only one doctor, she's only one assistant. And Michelle, our front desk, is also a dental assistant trained in the Air Force, but she mainly does front desk. And she's bilingual. And so even she reached a point where she was like, I can help with cleanings and stuff like that and exams, but we're kind of reaching a point as to how many patients we can see successfully in a day. And so I was like, okay, we got to hire another assistant. So did a lot of interviews, had a lot of no-shows, which is kind of weird for an interview, right? I mean, but it happens. And so we finally found somebody who applied, and she had experience, and she's been great. And they've been working together the past couple of weeks, and it's been really working out well together. And that fact that, for today, we were able to see 15 patients today with 2 assistants and myself as a doctor, and, see patients for treatment and also see patients for exams and cleanings and get everything taken care of. And everybody was on time in a timely manner, and we're able to keep everybody seen today. And that was awesome. So for me in my office, I kind of found like 0 to 10 patients in a day for a single provider and one assistant was kind of my limit of what I could do in a day.
Gotcha.
8 to 10. And then with two assistants, we can kind of do more like 10 to 20 within a day. And that's kind of just, I don't have anything official for that. That's just me. Because as a startup doctor, you have to be willing to do everything. You got to be willing to answer the phone, take insurance down, schedule people. You got to be able to go ahead and take x-rays on your own if you need to, do a cleaning if you need to, turn over a room, wipe things down. And so one of the things that part of our office culture is we don't have titles per se in our office. Everybody can do everything. Well, I mean, within reason, they can't cut teeth, but but everybody can do everything. The doctor, myself, I'm not above taking out the trash. I'm not above cleaning the toilets. I'm sorry if that's gross to people, but I'm not above that.
Yeah.
I'm not above going ahead and helping a parent check out so that my staff can turn over a room to bring our next patient back. I'm not going over consents and everything with the patient, because part of our office culture is that when we all work together in concert, we can create that environment and that experience within a pediatric neurologist that people and children are looking for. When we get into this concept of, oh, it's not my job or it's not my title, that's when we start to disintegrate a little bit and we don't work cohesively as a team. And the people that suffer from that, it's not my job, is the patients. And that's not fair to them. So we work together to go ahead and create an environment that is cohesive and family run, so that we can go ahead and we can do that together for our office culture. So that's kind of what we are at right now. And in the new year and towards the end of the year, I'm looking to add some more dental chairs so we can start seeing patients more. Right now, I only have 3 dental chairs in my office.
Okay.
I have one in a private room and I have 2 like in an open area room. And so I'm kind of limited as to how many kids I can see at one time because how many chairs I have. And it's like, for families, it's not a big deal. You can sit in the same chair your siblings sat in with different instruments. But like, for like different families, they're like, no, I kind of like, you know what I'm saying? It's kind of a little like that. So,
yeah.
And with, COVID and everything, we try and socially distance everybody we can in the office by trying to only schedule, like, we we're having a big family. We set them in our open bay area that has several chairs in there we can see, versus we have just like a private consult, then we'll see them in our consult room. That's kind of a private op consult room for them.
Gotcha. Okay, man, that's interesting. I like that. I like the part also where there's like no titles, right? Everybody has to be doing everything except for obviously like the main, like the production work.
It's kind of my job, I guess.
Yeah.
That's my job.
Yeah, everything else, I get you. So then let me ask you, throughout this year, since from the moment you opened, or actually from the moment you decided to do the startup and construction was happening till today, what have been some of your biggest struggles, your fails, or pitfalls?
Oh boy, do we have all night? No, I'm just kidding. I would say one of the biggest pitfalls I did was, and this is nothing against this type of marketing, I think this is fine. I was approached very early on by somebody who wanted to do like a mailer for people who move to the area, like new people who move in. And I worked with them for about 6 months, and just to make sure, just see what is ROI. And I paid them this company, like a monthly fee, and my name went out with every new packet that got mailed out when moving the area. And I literally got nothing from it at all.
Wow.
And it was like month after month. And then when I tried to cancel it, they came back and they were like, oh, you have a year contract. And I was like, oh, man, no, I have this email from you stating that I can cancel this even though I have a year contract without penalty. And they're like, okay, well, we'll make an exception. And like, it was to the point where like the representative would return my phone calls, like she wouldn't return my emails.
Yeah.
And I had to get my credit card company involved because she kept charging my credit card. And I finally was like, I'm not paying this. This is a fraudulent charge. Yeah. And I had to pay my credit card, get involved to stop the payments because they would not respond to my phone calls, my emails. And I was like, even now, I'm like looking back, I'm like, oh man, I really just wasted so much time on that. And I was like, but that's life. Okay.
Yeah.
And you're going to go through things. You don't know everything. You're a new business owner. You're learning things. And you know, if you're a new dental owner, you're a new business owner, everybody wants a piece, man. Everybody wants a piece of the pie. There's only so many pieces of the pie. And after a while, there's no pie. So you have to pick and choose who gets pieces of the pie. I would say probably one of my best investments that I made for my business was finding a local rep in the area that I could work with consistently, a dental supply rep, because the dental supply rep that I picked, she's worked in the area for years. She knows all the dentists in my area. And she was able to kind of also put the word out there like, hey, there's a new pediatric dentist in town. Did you hear about this? He's over here. You should really talk to him, help set up his office. It looks really cool. Here's the pictures on my phone. Come check it out. And so she was able to help kind of on the back end with doing that. And her experience with pediatrics, she was able to help me say, no, you know what, Gabe? I know you want this because you've always used this product. And, you know, dentists, we're very picky, okay? We know what we like. We know what we don't like. And she was able to say, I know what you like, but let's talk about why you like it. And let's find out something that we can do, because what you like costs 3 times as much as what I could get you, something that will work just the same. And we're not talking about things like composite. We're not talking about things like, you know, you don't want to switch up. We're talking about things like gloves.
Yeah.
Right? Like cotton pellets, like cotton tip applicators, like suction tips, like, you know, non-urgent things, like, you know, stuff like that, non-critical items, and focusing on things that you're going to use every day, like hand pieces. Focusing on things you're going to use every day, like making sure those are the best that you can get, because you're going to use those every single day, and helping to make those decisions together to get the best final product for you. So that was probably one of the best things I ever did for myself. And then I know I've mentioned Mango several times, but I mean, I know they've had their ups and downs, just like any startup in the world. Okay. But they've always been positive with me. And I've always had a good experience with them. And even my IT manager, I gotta talk about that for a second, but I'll come back to it. The IT manager was like, man, this phone system is really simple. Like, it's so like just straightforward. Like, it's not super complicated. And he said, it's nice, not putting a huge strain on your bandwidth, you know, like, this is a good product. He goes, this is super awesome. You get to have digital fax. You get to have all these kind of cool things available for a fraction of the cost of what you're paying. And it was a really good product, and I still like it to this day. I still use it. You know, I have the Mango app on my phone, and so does my front desk when she takes calls when we're not here. And so it's kind of been able to help us when we're not in the office initially, still be able to take phone calls from patients, still be able to answer those phone calls, and be able to go through with them exactly what their needs are, but not have to be physically in the office. That's really nice. I like that feature, because when you're doing a startup, you're not at your office every day. Sometimes you're working other places, but if someone calls your office and they don't reach you and they have to leave a voicemail, unless they're really persistent, the chance of them calling you back is not super high based on statistics. It's just not. So if you can answer the phone right away, even if you can say to them, hey, I'll take your information down when I get in the office tomorrow, I'll schedule you. You know, that's better than just saying, hi, thanks for calling. We're not here right now. Leave a message when we're at. Boop. You know, nobody likes to hear that. I mean,
and then you hang up.
Nobody likes that. You hang up and you get those like hang up calls. So nobody likes that.
Yeah, no, I get you. Yeah, I was talking to Jonathan about that, because Mango Voice is one of our sponsors, but like just without them being our sponsors, like I've always kind of talked to Jonathan. And I remember when everything kind of like shut down, right? Remember that one time where like Facebook went crazy over Mango Voice?
Yeah, because the servers go bad on Amazon. Yeah.
But then we did a whole episode on that, me and Jonathan, and then I realized that it only went down for like, I forgot, like an hour or 2 hours, but just it made it seem so huge on Facebook. Like people were like, it's down for days. And it's like, was it though? I don't think it was, you know.
I had friends like question me, like, why are you going with Mango? Oh my God, that's a terrible idea. Like, you know, they had a problem. And I'm like, hey, you know what? Yeah.
You're like, yeah.
No one's perfect.
Yeah, it was it.
Sometimes people go ahead and they make mistakes, but we own up to that mistake and be like, yeah, guys, we totally like messed up. And this is what we did. Because I talked to them when I first called them. I was like, hey, what are you going to do differently from now on out that's not going to prevent this from happening again?
Yeah.
And they had a very clear, concise plan. They had a very clear, concise way of going ahead and, handling those situations in advance. And, the funny thing that I remember from our conversation that I had with them, I spoke with, but he said, Mango still works on the app. If you have the app on your phone calls still come through. Even if the phones in the office are not working, it's a voice over IP solution, so they can still come through if you have it set up properly. And I was like, I wonder how many people who complained maybe didn't have it set up correct, or maybe never downloaded the app.
Yeah.
I'm just curious if they've never done it. Then I could totally understand the frustration. I could,
Yeah.
but it's been great for me. And then with our dental practice software we also use a program called Yappy. You've heard of Yappy before?
Yeah. Gina?
Yeah. So Yappy was really good. I talked with Adam a lot initially starting up in the phase, and he was really to help look at this stuff with me. And my dad's in IT and does IT management, has for years, and he reviewed Yappy with me because he wanted to see what it was about. And even he said, because he's worked in dental offices, large ophthalmology groups, urology groups for providing IT solutions, he's like, this right here is probably, he said, one of the best systems I've seen. He said, they have everything available. And they were very upfront, they're like, hey, if you don't like one of our forms, send us something you like, and we'll help build it for you to make it what you like. And we've done that a lot. We've done a lot of that. And, when it came time to come back and reopen, we were able to use Yappy to send an opening email to all of our patients and say, hey, we're back, we're open, we're seeing patients. These are the precautions we're taking, And we're able to also send a blast email to everybody at once through Yappy to let everybody know, hey, look, we're back, this is what's going on, And that was really nice to have that feature to do that with for a dental startup. Obviously it's a little expensive, but you got to remember too is that the cost that you're paying for a service like that is an investment. It's not going to be free. It's going to be something that you invest in. If you're investing in your business to make a greater overall experience for your patients, then that's a win-win, right?
Yeah.
As long as you're having the correct ROI, that's a win-win. So for me, having those systems in place beforehand really have helped to make things streamlined for our business, because we have almost zero paper in our office. We print a few things, but honestly, not much. Everything's done digitally. Everything's done, email or fax or text or things like that. Even though our patient reminders are through text. So it's really super easy and elegant. We don't have to worry and fuss about scanning this in, scanning that, printing this, filling this out on paper, scanning it in. It makes it so good.
Yeah, especially right now, you don't want to have to be touching a bunch of stuff and everything like that. People be preoccupied.
You can wipe down an iPad very easily. And most of the time we tell parents, hey, look, we'll send you a text with the link on your phone. You hold up your phone every day, so just fill it out on your phone.
Yeah, that's true. That's super true, man. Awesome. Alrighty, Gabe, man, we truly, truly appreciate you coming on the show and being on. But before we say goodbye, can you tell our listeners where they can find you?
Sure. So I'm located in Somerville, South Carolina, 2001 2nd Avenue, Suite 102, in Somerville, South Carolina, 29486. And call us on the phone if you have questions, 843-900-4490. You can also hit us up on our website, www.oaklandingkids.com.
Awesome. And guys, that's going to be in the show notes below. So if you want to reach out to Gabe for anything, and we're definitely I feel like we just scratched the tippy top of the iceberg of everything that Gabe is doing right now in his life, which I have no idea how you're doing everything, but you're making it happen, man. You're making it happen, and you're skyrocketing your practice. So it's awesome. We're excited to see the progress. Maybe 6-7 months down from the road right now too. It's awesome, man.
Thank you so much for your time, Michael. I really appreciate you inviting me on the show and giving me an opportunity to talk to you. It's been an absolute pleasure. Thank you so much.
Awesome, man. Yeah, we appreciate it, and we'll talk to you soon. Okay.
All right. Take care.